I dedicate this award to our mother Mary, because she's my role model.
Dr. Nkeiruka Chinedu-Anunaso nnukwu ada Amaokwe.
And felt that I deserve this award, that I will keep it up and I will try to do more. Thank you so much. I really appreciate it. And I'm going to support our CMO with a sum of 200,000 naira.
She's doing very well. Nnukwu ada Amaokwe.
So now pay attention. She has donated 200 to us, and she wants to make another donation. You want to make another donation? Just listen. So Prof want to support this. It makes another donation. So
let's see finish. I think she wants to make another donation.
Yes. Okay, so don't be patient. Just listen, have your pen and paper. And the supporters, they should just wait.
Christ is our leader. Christ is our leader. Today we are going to talk on our health. Why I think it possible that we have to talk about stroke? Anywhere you see me, you always hear about stroke, because that's the area of my specialty. Is either I talk about stroke, or I talk about epilepsy, or I talk about Parkinson's disease, or anything spondylosis, whether it's cervical or lumbar spondylosis, anything that has to do with the brain, spinal cord, and nerves. That is where I belong, and I derive joy in teaching about it. The why it touched me so much to talk about stroke again today is because I found out that a lot of patients that presented with what seems like stroke, at the end of the day, it not boiled down that those patients have cancer of the prostate with metastasis to the brain. So what I now do, any man that presents with stroke now, before I start, because most of the time they will present with ischemic stroke, I'll come down to that to explain which one, what ischemic means, what hemorrhagic means. The why it touches me to talk on this is because I found out that basically more than 80% of my patients that will present as stroke, when they go for brain CT scan and it comes out that the patient has ischemic stroke, I would then say, since this man is more than 45, let me do the PSA. By the time you realize what is happening, when you now ask the man, have they ever been told before that you have prostate? They say, yes, so they've told me that I had prostate and I've been taking drugs. They don't know that it's not just a question of having prostate, that the thing has transformed into malignancy. It's already cancerous. And initially we were taught that once a patient has cancer of the prostate, the first place that after moving to the testes, the next place is the backbone. Then we have realized that even before the patient start having that waist pain, some offshoots have gone to the brain. And because it forms like small balls, it will now go and block the vessel. And it will present stroke is blockage of the vessel. So those small parts from that cancer, once it moves from the area, the origin, less than 45 years, that will present with prostatism. And before you know it, the person has a large prostate. I always advise you, once you start noticing that you're having problem with urination, it's either you want to go and pee, you need to strain before the urine starts coming out. Or when it comes out, you find out that it's not flowing very well, the normal way the urine should flow. Or you notice that after urination, you notice that it's as if the urine is dropping gradually. Or you have that feeling that you think you are finished urinating, then there's that feeling in you that there's still something, some urine remaining. Or you notice that in the night you wake up several times to go and use the toilet. Even when you wake up several times, by the time you get back to your room, you still find out that you are pressed again. go and see your doctor. And another thing I want to advise is when you have been told that your prostate is enlarged, please, I am just advising you as a sister. Don't say, let me be taking drugs. Let me be taking drugs, because you know the erroneous impression we have is that once the prostate is removed, the person becomes impotent. It's not like that. It's when you allow yourself and it goes into malignancy, and then I told you that they won't just do a prostatectomy, that they will need to remove the testes. That one is orchidectomy. That is when the person is being castrated. But that initial time, it doesn't affect erection. So I always advise my patient, once you notice that your prostate is enlarged, don't stay and be saying, okay, let me take my drugs. Before, I have never seen, in short, let's be very frank to ourselves. More than 75% of patients that are presented with benign, it will turn to malignancy. So that thing you are trying to protect is just like a woman that has breast cancer, and they advise her that she should do a mastectomy, and she said no, that she doesn't want to do a mastectomy. Before you know it, the cancer will move from that one breast to another. At the end of the day, by the time the woman will make up her mind to do the mastectomy, once the cancer has left that original site,
I na-ekene unu dị eme maka isoro m okwu na agwa ya bụ ishe soro ya na agwa ya pịa nọ
we call that
ada m okwu.
no matter what you do, the person will still die. So the only advice, if there's nothing you're going home today, please, any type of state, go for prostatectomy. Even if the PSA, there's what we call prostatic specific antigen. That is what is being used to know when the prostate enlargement, whether you're dealing with the one that is benign or whether it has transformed from benign to cancer. The normal value is less than 4. PSA is measured in nanogram per ml. Once it's less than 4 nanogram per ml, is within normal. But I always tell my patients, even when you do the PSA and it is less than 1, once they've noticed after doing an ultrasound and the prostate is enlarged, please remove it.
Tell us where you're going
so that you are alive. Are you getting
so
what I'm
much
saying?
for joining.
So from there, why I'm saying this is that I found out that once a patient has been diagnosed for prostate enlargement, it's just you're just marking time. Because no matter how, and with this what we are having now, a lot of drugs we don't trust. You go, you're on some psilocin, you buy psilocin, you buy finasteride, you're on Duodat, you're on Proscar, and all those things. How are you sure that you're making the original one? Because a lot of things are happening now. But if you do the surgery early enough, remember I said early enough, when you do the prostatectomy, when the enlargement has transformed to cancer, or when they have left that original site and has come to the waist, has attacked the bone of the waist, or maybe has gone to the brain. Because I've noticed that by the time the patient starts even complaining of waist pain, some of them have boiled down having cancer, having a stroke. So I find out that by the time the thing now travels to the brain, nobody will tell you that it has already gone through you understand? Because by the time it gets to the brain, everything has gone around the body. So the best bet is always to be on the side of caution. So let's talk about the stroke. Because we find that now, I don't know what to say. I don't know whether to say that it's like epidemic. I don't know whether it's because of the economy of the country. You find that there's a lot of people, and the worst part of it, the patients I had the other day, 2 days back, the guy is 43 years, and he has stroke. And you find out that a lot of things, most times the way our lifestyle, we are trying to adopt Western culture when we are not Western, when we are not white. God made us in such a way that we are Africans. And as Africans, referred there as organic. Then we don't like taking them. Most of the time, even we women, we don't do the work we are supposed to do as women. We don't cook. And to my greatest surprise, we find out that some women, they don't even cook in their houses. They will now employ caterers. They will cook and they will bring the food home and be giving their husband and their children. And I'm like, why will you do such a thing? Because you don't know what those people are using to cook those foods. And for crying out loud, anybody that is cooking food outside is doing it to make money, is doing it to have profit. So you will not expect what is prepared outside to be of as high quality as what you will go to the market and buy and cook. If you take a visit to all these village markets or the normal markets we have, you find out that when you see, like, let's take tomatoes for example. When you go to that their area where they sell tomatoes, you see the ones they call our. Just watch out. All those people surrounding those our are the cookers, all these women cooking food, because they want the cheaper ones. But no mother, no reasonable wife will go to the market and start buying those rotten tomatoes, because they know that those rotten tomatoes, they contain a lot of fungi, and as a toxin, that will kill the body. That's why for the fact that all those women, when they just need to have it, especially to have that feel that they got tomatoes, they go for the cheaper ones. And you find out that our lifestyle is what is killing us. We take a lot of job. Sometimes when they go to work, they don't carry their food. When did we start every time taking drinks and sandwiches? So crying out loud, all those things, we are putting a lot of junk, a lot of poison in our body in the name of food. Nobody takes good food. Nobody eats well. But once you are above 40 years and above, our diet should be less of carbohydrates. You are not very active, they say. Are you getting what I'm saying? You are just trying to maintain the status quo. So what you now need at that point in time is what will make those organs in the body to still work well. And for crying out loud, those fruits and vegetables, what they do is to try and help all those dead cells in the body to rejuvenate them. And like we all know, neurons can never regrow. Nerves, they don't regrow. What they do is they rejuvenate. So what you now do to rejuvenate them is when you try to take a lot of multivitamins. And you get the multivitamins from fruits and vegetables. So at least once you're more than 45 years, what you should aim at is take a lot of vegetables, fruits, protein.
Thank you for joining Amokwe TV. Tell us where you are joining us from. This is Wada Amokwe. And in Imo State, in the Catholic Men Organization Nigeria lecture on health, like cancer.
I can remember when I told my father-in-law sometimes, the guy said, this your alcohol, you have to stop this. He said, if what you went to medical school to learn is for me to stop alcohol, you have not started. I said, that guy, I didn't say you should stop alcohol in moderation. And that is what I'm trying to tell us today. Moderation, they try and take a lot of water.
Make sure you have shared this video, let others.
Sleep is very, very essential. You may think that you are indispensable. In short, I walk around with club, especially the CEOs.
Share this video, please. Let others learn.
Always leave some time to sleep. Ideally, you should get up to 8 hours of sleep in a day. Ideally, you should get up to 8 hours. And when I mean 8 hours, it's not when you break it. You will tell me in the afternoon you had 2 hours. After some time, no, that's not what I mean. Ideally, then we know that sometimes it's almost impossible. So we now advise people to try and make it at least 6 hours. And you know one thing, why sleep is very, very important. You will find out that sometimes disappeared. It is the work of sleep. Under my specialty neurology, there is a subspecialty called sleep medicine. And it's in that sleep medicine that you notice that sleep has stages. That is why if you come to me and tell me that you are not sleeping, I will not give you a sleeping pill. Because all those sleeping pills you are taking, they don't go through the normal stages of sleep. And when they don't go through those stages of sleep, you will wake up not being refreshed. And that is why you see some people, when they keep taking Lexotan, after 1 week you take Lexotan again, instead of to sleep, you will not be awake. Because all those anxiolytics, they were not meant to be taken more than 5 days at a stretch. And even when you take sleeping pills, you will not wake up and be refreshed. Because it doesn't go through those stages of sleep. On those stages of sleep, there's a particular stage in sleep. What it does is to wipe out a lot of things. You know, let me give you an example. It's like when you come to a room that is infested with cockroaches, and you use fleet, insecticide on it, and the cockroaches will die. They will die. But nobody has maybe tried to sweep, pack those ones that have died and throw it away. You leave it there. That is the work. When all those after hustle and bustle during the day, the stress, as you wake up in the morning, you walk, those people that walk around like a Nkeiruka and brother and the patient, patient is bed rest. And the person will wonder, why are you just giving me bed rest? They don't know that there is no medicine, there is no drug, there is no treatment like rest. Just have a bed rest for some time. So you find out that those things are very, very necessary. In the case of women, we have a lot of autoimmune disease. The body is now attacking itself. That's why there are some illnesses we learn in school. We never knew it doesn't happen to blacks. But we have started seeing all those things. SME. You understand? All these autoimmune, Graves' disease, mycelial Graves' disease. Even whose illness we remember. We read them in school. They don't happen to the blacks because of the nature of our food, because of the way we live our lives, because we eat natural food, because we sleep. So if you don't give yourself that time to rest, and the body does not have time to clean up all those deaths, or in the room to sweep those cockroaches that have died, you know what will happen. The next morning, the body will now see that cockroach. I will not say because the cockroach died, and instead of lying upside down, the cockroach is lying as if he's still alive. And to clean up all those things, you didn't give the body the time to do the work. All of a sudden, the body sees itself walking again. You didn't give the body, so the body will not say, this thing is still alive, oh. Why is this thing still alive? Without knowing that thing, you will not start hitting on it. Because the cockroach is embedded. The same thing that happens in our body, like you find that somebody will keep telling you, I'm having typhoid every day, I'm having this one every day. Because sometimes those drugs you will take, the bacteria will be killed, still deposited in the body. You don't have time to sleep, so that the white blood cells will have time, the macrophages in the white blood cells will have time to sweep out all those bacteria that have been killed. You left it like that, you left it, that bacteria, because it has not been removed, will go and attach itself either on the heart, or on the liver, or on the spleen. The next day, when the white blood cells, the lymphocytes, the next lymphocyte will then see them, say, I thought I've dealt with this bacteria. So you're still there. It will now go and assemble more arsenals to come and fight. Because that thing has died. The whole thing will now attack the organ. And the body will start attacking itself. And before you know it, the person is having chronic liver disease. The person is having kidney disease. The person is having this and that. You find that there is a lot of illness. And we are the cause. A lot of stress. We don't have time to rest. We don't even have time to eat good food. You see somebody, what he has eaten or she has eaten in a day is meat pie or pizza. Because he wants to show off. Showing off rubbish. Showing off the world. Making gap with death. You see somebody, the person will take pizza and tell you that I'm taking pizza once, and that good at this, even making guys showing off with pizza without knowing that the person is putting in poison in the body. I'm not saying that pizza is not good, but I'm trying to say that even if you must take it a little, then but at this age we are now, we should concentrate more on fruits and vegetables and protein and a lot of water. Everybody should be targeting. I always tell them when you want to drink water, don't use all these small cans. Because when you use all these small cans, you think you have taken water. You see that big one, 1.5. Ideally, a human being needs 6 liters of water every day. So when you now calculate that 6 liters of water every day, is that big ever water bottle full? Are you getting what I'm saying? So if you condition yourself in such a way that you can be taking that water, I didn't say you should go quick down at the same time. But once you wake up from bed, before you even kneel down to say your morning prayer, take water. You've not brushed your mouth, you've not done anything, you just woke up from the bed. Always keep a gallon of water. I always keep a gallon of water at my bedside. Once I get up, I will drink water. It may not taste good, but if you keep trying that, you will see a difference. I'm telling you. And when you start doing that in the morning, but once you start getting up to 5 p.m., 6 p.m. in the evening, reduce your intake. Because if you don't take during the morning and afternoon period, and evening, you want to use the evening and cover up, you end up not sleeping well. You keep waking up in the night to go and pee. And at the end of the day, you wake up not being refreshed. So I always advise people, once it gets up to 5 p.m., reduce your intake of water so that you can be able to sleep well. Then in the case of stroke, there's another thing I want to tell us where stroke is involved. We can always get well, even after having stroke. People don't know that we have this drug. We have a blood buster. And this blood buster, once somebody has stroke, and the person presents to the hospital that within 1 hour, when the person has stroke, there's a drug we normally inject the person. Once we inject that drug, within 2 hours, it works like magic. The person gets well. Yes, we call it blood buster. Don't ask me the price. But the only thing is that it's better you get the injection and get well than you end up having paralysis and you will not be able to make money, especially if you're a CEO. So the only advice I want to give us is that stroke is of 2 types. Don't have any person that has stroke, your relation, or maybe all of a sudden. Stroke can just manifest as blackout. You'll be waiting for the time you will be able to move your hand or your leg. You will not be able to, maybe your mouth is related to one side. I think that's the only time you have to. It is not true. It may just manifest as all of a sudden you can't see. Because there's a blockage in the vessel, the retinal artery, the vessel supplying the retina. And once it happens, the person comes with blackout. It may just happen, the person cannot talk. All those things are what? Stroke. So the only thing is that it is always good when somebody has stroke, we do a brain imaging. The brain imaging will tell us, are we dealing with a blockage of vessel in the brain or are we dealing with a rupture? If it's a blockage, the way we treat it is different. If it's rupture of the vessel, the way we treat it is different. So that is why it's good. And if you try to use the treatment for hemorrhagic for ischemic, the patient dies. So that is why when you have anybody that has stroke, the way it happens, rush the person to a specialist hospital. And if the person comes in within that 2 hours, and we find out that the person has just blockage of the brain, and that thing is not much, we give the blood buster and the person recovers within 2 or 3 days. Thank you so much.
That's an outstanding ovation for our big mommy, Dr. Nkeiruka Chinedu-Anunaso.
This donation pass the cash. We thank God for the president. So there is no question for this one, no question because of time. We call on those who support our mommy. I see some CWO women that came with her and then first Professor Adonai to support her. I know Sanjesi, Chukwu and the rest of them are here to support. So,
CMO, drink less water, and more water and less alcohol. Even though I'm not competent to speak on that, I'm not a professor of medicine, I'm a professor of management and business administration. I only come out here to commend those our brothers, both the Knight of St. John and Knight of St. Mulumba, and also to thank those people that came out to support a Knight of St. John. But myself as a Knight of St. Mulumba, a former GK for almost 7 years and 8 months, I want to thank those my brothers and their sister. You know, when I say sister, she is my sister. In KSM, we call our wives sisters. So, like I said, I'm not going just to support with money because I'm not aware that I will meet my brothers here as a segment of this. But I want the body to please use this 5,000 naira and buy pure water for them. Those my 3 colleagues of the Knight of St. Mulumba. Thank you.
thank
Thank you very much.
Yes.
CMO,
Leader.
CMO,
Christ is our leader.
Christ is our leader.
CMO.
The last awardee is from my sub-council, also our joy sub-council, the Knight of St. Mulumba, Owerri. And two, a very close sister of mine. The husband is very close friend. Without wasting of your time, I'm supporting her with some of our time.
Thank you. Thank you.
Thank you, sir. Thank you, brothers.
Yes, CWO are here. We don't know how to clap this CWO clap. Otherwise, we are not the CWO clap. I love you. Amen. Okay, give the microphone. Let the chairperson.
Please do.
And the
Maria.
I want to stand on the 16th protocol to say you are all doing well. I love what is happening here. And we heard it when Dr. Nkeiruka was giving her lecture. It was there. She killed it. She killed it. Even more than maybe do a blue and go over and always is appreciate. I'm telling you, without wasting our time, I want to appreciate this award. This is CWO Aman Chaplaincy. That's the people you're seeing here. We want to appreciate this award with a sum of 20,000. And some of us are going to appreciate that too.
Thank you very much, my digital president. Praise, I thank God it's like we are all in this. And when you come to people, culture, so we now want to talk about economy. We all belong to Alvan Chaplaincy, and that's the president. But it's still in the Alvan Chaplaincy, we have things. My precious was a day, because in she's pronounced St. Teresa too. And on behalf of St. Teresa's zone, we are saying we are glad, we are happy, we are supporting her with a sum of 10,000.
Wow, thank you. God bless you. God bless you. Any more supporters? All right, thank you.
award is coming to our very own sister, Dr. Nkeiruka Chinedu-Anunaso. She received an award today, the only woman among the whole awardees. She's a consultant neurologist at Federal Teaching Hospital Owerri.
For those who didn't understand what they said, you know, before we used to say that women education is in the kitchen. Gone are those days.